I am of the point of view that I still think the most likely etiology of this pathogen in Wuhan was from a laboratory, escaped. Other people don't believe that. That's fine. Science will eventually figure it out. It's not unusual for respiratory pathogens that are being worked on in a laboratory to infect a laboratory worker.
That was former CDC Director Dr. Robert Redfield on Friday, endorsing the theory that the coronavirus came from a lab accident in Wuhan, China. But now the World Health Organization is offering a different explanation, or several explanations, actually, in a joint study expected to be released today. The WHO and China, the Chinese government, say the lab theory is unlikely. They also say the best theory for how COVID started is animal to human transmission. But the report is being met with a great deal of skepticism, as Beijing never allowed full access to investigators. NBC News senior international correspondent Keir Simmons obtained a copy of the report. He joins us now from London. Keir, good morning. It's good to see you. So there's been a lot of skepticism, as I said, around this. Dr. Fauci said, I want to see the underlying information. I want to see the data that went into this. Secretary of State Blinken said, well, China helped author this report, so take it with a grain of salt. So what were you able to cull from reading through the report?
Hey, Willie. Well, I think the conclusion at this stage is that there are an awful lot of people with a lot of theories and not a lot of evidence, be that lab leaks, be that transmission from bats to another animal to humans, be it the Chinese idea that maybe it was imported on frozen foods. This is a copy of that leaked report obtained by us at NBC News, 123 pages. We think when it's published later today, there will be appendices in here as well. And I mean, you can see, Willie, it's thick. So there's a lot in here. It is thorough, but to summarize, it is a thorough evaluation of Chinese scientists' analysis. And just to give you one example, on the sensitive issue of whether there was more coronavirus in the Wuhan region back in late 2019, it says that doctors and scientists in China evaluated 76,000 cases of illness in hospitals, narrowed them down, and this is a panel of people, it's not an algorithm, so somehow narrowed them down to 92 cases that might have been coronavirus, tested some of those 92 people, found them all to be negative, and therefore dismissed the suggestion that there would have been a lot more coronavirus around. The report is relatively cynical, if you like, about that, and says more research needs to be done. It's just one example. And as you mentioned, the context of this is the US government's concern about a lack of transparency by China and by the Chinese government in Beijing. This was Secretary Blinken talking to Andrea Mitchell a little earlier this year.
There's no doubt that, especially when COVID-19 first hit, but even today, China is falling far short of the mark when it comes to providing the information necessary to the international community, making sure that experts have access to China. That lack of transparency, that lack of being forthcoming, is a profound problem, and it's one that continues. And so, as we're thinking about both dealing with this pandemic, but also making sure we're in a position to prevent the next one, China has to step up and make sure that it is being transparent, that it is providing information and sharing information, that it is giving access to international experts and inspectors.
On the question of a lab leak, guys, the report says that it is extremely unlikely. What's going to raise eyebrows is that it at the same time says that there is grounds for investigating military games that were held in China, which the Chinese government has suggested because there were Americans there. Maybe that would be a source. It also says that it's worth investigating frozen foods, as I mentioned, another Chinese theory. I mean, crucially, just on the front here, it's called a joint WHO-China study. So it's very explicit. It's a study by the by independent experts brought in by the WHO, international experts, and the Chinese. I mean, that's what it is.
All right. Thank you so much, Keir. We greatly appreciate it. Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.